Hello, everyone. I'm Dr. Van Merkle. It's great to be with you today. And we've got a good case here. One of our doctors sent in a note that he'd like some help on this patient. Patient presents with just overall malaise, not feeling good, and she's gaining weight. And wanted to know if we'd take a look at the labs. We did, and we see that now on the first test on 6/7/2019. Today, by the way, is July 9th, 2019. So on June 7th, the blood test was done. Patient came to this SBN member, and with these complaints, she's 42 years of age, and she's been gaining weight this last 6, 7, 8 months. And here's the labs we see. We see a high creatine kinase. We see an extreme high TSH of 217, extreme high 217, and an extreme low of 1.2 on a T4, which should be at least 4.5. And that was our standard foundational panel. They asked for our advice, and we recommended a more thorough thyroid evaluation as well as retest the CK, and the CK shot up to 575. And the TSH was at 217, and it shot up to 272. And now we also see a very low T4 free, a very low T3 total, and a sky high thyroid peroxidase, TPO antibodies. Now, what could cause such a thing? Well, her history, 6 years ago, she had a total hysterectomy. She was 36 years of age then, and she just had the hysterectomy, no further treatment, no bioidenticals, etc. About a little less than a year ago, she was recommended bioidentical hormones, and she went on bioidentical hormones, estradiol, etc. All these bioidentical hormones, and since that time, she's put on weight and felt worse and worse. This is common. Bioidentical hormones create more problems than we're led to believe, but they almost always cause thyroid dysfunction. That's why people on bioidentical hormones gain weight. That's why women on the birth control pill gain weight. Years ago, Premarin and all women on in menopause were put on estrogen or Premarin, and they all gain weight because they shut the thyroid down. And that's what I believe is happening here. The thyroid is shutting down because of bioidentical hormones. There's some reaction there to the synthetic hormones, and bioidenticals are synthetic. Don't be fooled by the name bioidentical, because they are not the same that your body makes, and they cause reactions and problems. So I'll talk about bioidenticals another time, but I believe that is a terrible, misleading name to call them bioidentical, because they're not exactly what your body makes. So this lady's been on these hormones, these bioidenticals, for several months, and looks what's happening to her thyroid. It's getting worse. And in just a month, it shot up dramatically, even higher the TSH. And the higher the TSH goes, the lower the thyroid function, because the TSH produced by the pituitary is trying to whip that thyroid and get it moving. But the bioidenticals are shutting the thyroid down, so it can't function. It's getting worse. Now, it's also very common for the creatine kinase to go high as the thyroid goes low. And we see that happening here. And that's pretty dramatic, 237 to 575 in just 1 month. There's some serious damage occurring here. Now, because this was so extreme, we did refer this one out. We did recommend she see an endocrinologist immediately. She may need to go on medication. However, I also told this doctor that if this were my patient, I would highly recommend that this patient stop all bioidenticals immediately. There's really no harm if she just stops them immediately, other than maybe a hot flash or two. But I believe she needs to stop them all immediately to see if these numbers drop, because they do, it's due to the bioidentical hormones. So, but in the meantime, I recommend she go on thyroid, go to her endocrinologist, go on thyroid medication, so that she doesn't have a serious problem from such extreme low thyroid. I believe she'll respond quickly, but maybe short term, a little Synthroid will buy us time until she gets off the estrogen. Now, how do you get the estrogen out of your system? The bioidenticals out. exercise, muscle building exercises. You got to exercise hard. You got to sweat to burn that estrogen out. It may take a few weeks. And so I'd recommended a protocol for this doctor to follow, the proper vitamins for such a low thyroid. But I don't believe that the vitamins, the nutrients I can recommend for low thyroid are going to be sufficient in the short term to help this patient. She gets off of those, get her body healthy, burn out the estrogen. I believe she'll respond very nicely and have much better results just following the program. So be sure and test properly, doctors. And everybody needs to be tested to see what's going on here. You know, if somebody's not feeling good, a lesser doctor said, oh, just go on a gluten-free diet, or you need probiotics. You got to be a better, smarter doctor than that. Test and see what's going on. The results are often obvious, and the solution is probably easy once you know what the problem is. So I'm Dr. Merkle. We'll report on this one in a few weeks when we get this lady retested. I'm expecting to see good results. So doctors, go out there and test properly. If you're a patient, you're having health problems and you'd like some help, contact Science-Based Nutrition. I've trained thousands of doctors all over the country, and we may have someone in your area that can help you with your problem. I'm Dr. Merkle. Have a great day.